So now I'm going to discuss why I chose urgent care medicine as my profession. Please keep in mind that this is within the context of the urgent care company that I work for and does not represent all urgent care companies across the United States. These are some major points from my perspective. The first reason why I chose to practice urgent care medicine: patient variety. In medical school, we complete rotations in different medical specialties. Thinking back on that time, I would always say to myself that I would miss different pathologies from previous rotations. I would be on my psych rotation and think to myself, I really miss pneumonia. Or I would be on my surgical rotation and I would say to myself, yeah, this is really cool, but I really miss diabetes. Or I miss schizophrenia. I miss bipolar disorder. I miss pregnancy, etc., etc., etc. That's when I knew I had to go into a medical specialty that would allow me to see it all. Family medicine was that specialty. In family medicine, I was able to see all age ranges, all organ systems, and even take care of pregnant women. Urgent care allows me to go one step further and potentially see life-threatening conditions. I like the idea of potentially seeing everything and anything, which brings me to the second reason why I enjoy urgent care medicine: the diagnostic process. I have to figure out the diagnosis of this wide range of potential problems and determine the treatment plan within a relatively short amount of time. Despite not having all the resources of a hospital, I still can rule in and rule out a lot of disease processes, treat a lot of different conditions, and determine if a problem is life-threatening. While this can be stressful at times, I really enjoy the process of figuring out the problem and getting to a solution. However, if I cannot diagnose the problem, or the problem requires a higher level of care, or the problem requires a treatment that I cannot do, then I will refer the patient to a specific specialist, the ER, or I will treat the patient the best way I can and have the patient come back for follow-up. The next reason why I really enjoy practicing urgent care medicine is because I enjoy taking care of real-world, everyday problems. So what do I mean by this? In urgent care medicine, we see things that affect the average, everyday child or adult. We don't typically treat or diagnose rare, exotic medical problems that only affect 1% of the population. Every single patient population is affected by the problems that I see on an everyday basis. I'm not going to diagnose some super rare, esoteric disease that is on the cutting edge of medicine, but I will see cough. I will treat somebody's back pain. I will be able to diagnose somebody's abdominal pain. I will figure out why somebody is having a rash, etc., etc. These are the problems that affect so many different people. I am very thankful that I can be the type of doctor that can affect so many people's lives in a positive way. The next reason why I really enjoy practicing urgent care medicine: minor procedures and wound care, laceration repairs, incision and drainage of abscesses, foreign body removal, and I've even removed a cockroach from a patient's ear. I have a video discussing this case coming out soon, so be on the lookout for that. Lastly, urgent care provides me the work-life balance that I want. Urgent care is what is called shift work. This means that I am scheduled to work a set number of 12-hour shifts each week, but I do have some flexibility in the shifts that I choose, and I can also pick up extra shifts if I want to. Once the shift is over, I am done for the day. I am never on call in the middle of the night or any time that I'm not scheduled to work. It is this work-life balance that affords me to make a great living while at the same time enjoying the life that I have. Just like everything in life, urgent care practice does have some downsides. There is very little continuity of care. The company I work for assigns me to different urgent care clinics each day. Therefore, the chances of me seeing the same patient twice is rare, which can be a good thing if you run into those not so nice patients. But this also means that I rarely see the outcome of a patient's treatment, which is something I do miss from my days working in primary care. Unfortunately, there is also no prior relationship with the patient. So there can be a lack of trust on both sides, and there can be personality clashes. I have learned how to build good rapport with my patients in the limited amount of time that I have, and so this helps to build trust. Does this work all the time? No, but you do what you can to provide the care that the patient needs. Even though there are some not great aspects of urgent care medicine, I am still very happy to be part of this area of medicine. So that's the end of the video. I hope this video has provided you more information about urgent care medicine and that you can see urgent care medicine in a different light than you have before. The references that I used are linked in the description below. Thank you for watching, and I will see you in the next video.